Hi friends, in this video we are going to see about charge entry in US medical billing. Initially I thought of uh, doing showing you all the forms in this video itself, but because of time constraints and we have a lot of things to cover and the introduction itself for charge entry. So first we will be discussing about charge entry process, how it's done on software, and some of the denial management steps and the frequently asked questions. And these things we will cover in this video. Later on, we will look at a separate video wherein we will look at the charge entry sheet details. Then we will have a separate video for all the forms. This is how I have planned. And for those who are listening on podcast, you can type it as Joel John J. You can see the spelling. For it's Joel space John J. So for I am saying this also for the people who are watching this video on YouTube. So if you search it as Joel John J in YouTube, you'll find my channel, identify it with my photo, and subscribe to that. And for people on you watching on YouTube, press the thumbs up icon below, subscribe, and enable all notification, as we are going to come up with series of videos. If you enable all notification, you'll be able to see that. Apart from that, I also have other videos, and mainly for people who are searching listening to this on podcast. If you want the text details, you can search on YouTube as charge demo and charge entry video, charge entry process, and payment posting videos by Joel John J, so that you will get my video playlist. You can watch on that as well. And now getting into the process, if you have any queries, also comment on the comment box. I will reply to you on that. And charge entry in US medical billing is what we are going to see. What is charge entry in medical billing? First, I will give a short intro about that. See, once a patient comes to the US hospital for a uh, planned visit, that's before 48 hours itself, they know they are going to undergo this specialist visit or diagnosis or treatment. They will get a prior appointment, and the front office will have their demographic details which are already entered in the system. If they are a regular, if they are not a new patient, if new patient, they will do this and create a medical record number. Once the medical record number comes, whenever the patient comes in, they will just create an account number which will be linked to this medical record number, so that for the full patient records will be there. Now we are going to get into this charge entry mode. Charge entry, what happens in the front offices, they will create a super bill. Okay, once the procedures are done, they will create a super bill. This super bill will have some information which is a kind of an invoice. Based on that, to submit this invoice to the insurance company and get reimbursement for the amount. Like the US hospitals will first check the insurance card details, check whether it's in network or out of network. Does this process needs prior authorization? If those are needed, they will do that, and they will give all the details in the to the charge entry team. What this charge entry team does is, in the super bill or charge sheet, they will have the CPT codes or HCPCS codes which are done for the treatment, and the billed amount also will be there. Based on that, these people will key in the charges in the software, and that will be generated as form and sent to the clearing house, which the insurance company accepts or rejects based on certain criteria. If it's a clean form, they will accept. If not, they will drop. Once this is accepted, then that will go for claim adjudication team in the insurance company, who will be deciding how much to pay for each claim. Okay. Now, getting into the definition and others. What is a charge entry in medical billing? Charge entry is the process of assigning to the patient account an appropriate dollar value as per the chosen medical codes and corresponding fee schedule. The reimbursement for the healthcare provider services are dependent on the charges entered for the medical services performed. Charge entry must be completed without any error, as errors during charge entry increases the claim denials. Ensure effective collaboration between the coding and the charge entry teams to ensure that the charges captured are accurate and all procedures are built for. So the success of the billing mainly depends on the collaboration between the coding and the charging team. You have to correctly charge for the particular codes, and you have to ensure that the charges are captured accurately based on the fee schedule. If you capture more than fee schedule, then they will reject it. And also, if it's an out of network patient, you will be directly quoting only the charge fee. The insurance company claim adjudication team will have a price list. Based on that, they will say that only this much is the allowed amount. Okay. And steps in charge entry process. The process involves the following steps. Receipt of documents. The documents will be like charge bills, charge tickets, and associated clinical documents via FTP server. That's the file transfer protocol. That's the kind of networking word. And or EHR, electronic health record software, or document management system, whatever your client, that's your provider office or facility use. Based on that, they will give you the details. And what you are going to do is you are again going to record these details in your charge entry pages, so that it will be converted into a claim form. What are the details you are going to enter is record the patient demographic information, date of service, billing provider, referring health provider, point of service, which is called as POS, date and time of admission, ICD-10 codes. 10 stands for the current version of this ICD codes, and ICD stands for International Classification of Diseases. And what that is stands for what are the diseases diagnosed by the doctor. That could be a PCP or specialist or some other healthcare practitioner who is going to diagnose, whom the patient visits, and he will find out what are all the diseases, and also he will gather information about the patient medical history. And they will have something like primary CPT code, secondary CPT code, and other supporting codes. The primary CPT code will be the main procedure for which they may require an authorization, and then sometimes they will also ask for a secondary code. All those things the other teams will be taking care of, but you should know, like finding that you should know what's the primary code to be built, what's the secondary code, what are all the other CPT codes to be built. And what you will do with this CPT codes is, apart from CPT code, whatever the CPT for this, they will give the CPT codes as well. CPT codes are current procedure terminologies, the medical services and the procedures prescribed by the doctor, and also how many number of units which they are prescribed. And in some cases, they will add a modifier. What are these modifiers? Modifiers are codes used to build specific services. For some specific services, they will build a CPT code along with the modifier. This will be given by the doctor as well. Or in case during denial management for rejected CPTs and HCPCS. That HCPCS stands for Healthcare Common Procedure Coding System Level 2 codes. And the denial management team will comprise of accounts receivable callers, or shortly called as AR callers, or accounts receivable analyst or AR analyst. What these people do is, mostly the AR callers will directly ask the insurance rep whether the CPT can be built with a modifier. If they say that this CPT code cannot be built for this procedure, or for this patient, for this based on the medical necessity, they cannot bill it, or this is mutually exclusive bundle. There are so many criteria in which they will say that the CPT code cannot be built. Okay, so on that cases, they will ask whether it can be built with a modifier. It's a kind of a default question. If they say yes, they will send it to the medical coding team, and the medical coding team will come back with a solution. For AR analyst, these people will check in a sheet called NCCA edit sheet, which will have the information whether the CPT code can be built with a modifier or not. Or in some cases, it will say that this CPT code is not at all applicable. And some cases, they will say that this can be built with a modifier. Based on that, they will send it back to the medical coding team, and medical coding team will add the modifier and send it back to us. So under case, that's one case wherein we resubmit a claim. Okay, there is another one process called as resubmission of claims. For that also, again, the charge entry team will be working on. Okay, So this is questions they mostly ask for experienced people. For freshers, they hardly ask whether you have an understanding about medical billing, about the charge entry and demography, what is demography, and what you do in this, like that. They will go with simple questions. And if you are going for an higher level management, these kinds of knowledge is required. That's why I am giving an in-depth resolution. And also AR callers, analysts, those people also need this knowledge so that they will know where the problem is, where it goes, and where it gets corrected, all those. So charge capture and entry, how this process works. Scan super bills to be sent to the charge entry processing executive. Charge capture is the process where providers use to get paid for the services rendered. After documenting a patient encounter in the medical records by the provider's office on their health information management software, medical coding staff assigns the CPT code, current procedure terminology codes, based on the treatments which are provided and the diagnosis which are done, and the other medical procedures and services provided by the doctor, specialist, could be a specialist or a primary care physician, and so on, to that particular patient. The charge entry team reviews the patient demographic information and posts the ICD or CPT codes and the corresponding charges based on the fee schedule. The discounted fees for services in your facility provide whether the what is the fee schedule. This is an important question they ask. Fee schedule is a discounted fees which when they have an in-network tie-up with the insurance company, the providers or the facility give to that particular insurance company policy holders, they will have some kind of percentage discounts on various types of services and treatments given. That will be given on the fee schedule. If it's an in-network, you have to follow the fee schedule and only quote that fees. If it's an out-of-network facility, then you only, if the patient plan has out-of-network benefits, his insurance plan, you will be directly putting the regular fees. That's what is mentioned over here. Fee schedule, discounted fee for the services if your facility or provider is an in-network facility and provider in the patient plan, insurance plan. In the patient insurance plan, they are in-network. And regular fees if your facility or provider is out of network. Provider in the patient plan and the patient has out of network benefits in his plan. This, he doesn't have these benefits, then you cannot bill the insurance. It will completely going on the patient side and patient have to pay the money. Okay. The benefits and eligibility verification team provides the details of the patient insurance is valid or not and whether it has in-network benefits or out of network, and does the service requires prior authorization or pre-certification. All these details are provided. And in case of out of network, they will also check whether the patient plan has out of network benefits. If not, they will ask the patient to pay the amount. He has to pay. He cannot avail the insurance benefit. Note, if the patient insurance is out of network and does not have out of network benefits, then no need to generate a claim form to the insurance, as the entire amount has to be billed to the patient. And if an insurance company claim is fully denied for this reason, then no need to rework on that. One rework which they can do is they will again recheck it from the eligibility and benefits team. If they also found that there is no cover, then they won't send it to itself. Even if that comes from them, it comes to you without the eligibility team verification, then you have to send it to them. That's why I said for your senior people also, this video is very important. Okay. And for transferring the process internally within the RCM cycle, you have to understand whether if, for an AR analyst or AR caller, if it's fully denied for that, saying that this patient doesn't have out of network benefits, then and also it's an out of network facility, then you have to send it to the eligibility verification to him to verify again, or you have to do the eligibility verification. In some cases, AR callers do that as well, and AR analysts, they themselves do it and check, and then they can send it directly to the charge entry team if it's has in network as out of network benefits, or if it's in network. Otherwise, you have to just send it back to the for billing the patient to the payment posting team, instructing them it's out of network, so bill the patient completely. And then or the payment posting team will decide whether this will be going into the patient account or to the doctor's office as write-off. As I told you, during the registration itself, they will get waiver of liability form for charging the patient, billing the patient if that fails. And also another one thing is assignment of benefits. Without assignment of benefits also, we cannot do the charge posting. Even if we do that, the insurance company adjudication team will reject us. Okay. And then I already told you, it will be transferred to the as a patient responsibility or provider write-off on few other factors by the payment posting team, and the bills will be sent to the patient or write-off the amount as provider write-off. So that's what will happen on the payment posting team. In short, the charge entry team translate medical code, CPT and revenue codes to charges. Okay. The charge entry process in medical billing software, how it's happening in the software environment. The charge entry executives views the charge sheets and enters the treatment details and the relevant CPT, current procedure terminology codes on the medical billing software for provider charges and revenue codes for facility charges. This thing is something very important. Provider charges will be based on the CPT codes and facility charges will be mentioned on the revenue code format. Okay. And for revenue codes, the charges will be on the UB0 form and CPT codes will be on the CMS 1500 form. Okay. The software will have the insurance details and the fee schedule of the provider. Medical providers like specialist, primary care physician, and skilled nursing facilities, etc. And the facilities will be like hospital, diagnostic centers, skilled nursing facilities, etc. Skilled nurse is a provider. Skilled nursing facility is a facility, like that. That's something like building or instruments. These are all will come under facility. And people, human skill related things will be mentioned as provider. Okay. Already uploaded based on their agreement with the insurance company and discounts offered on the fee schedule. These things will be already agreed upon in case of in-network. In case of out of network hospital, it will be directly billed based on the fees charged by the provider or the facility. If the person doesn't have any insurance benefits, they will be having a charges. That's a non-discounted charge. That will be billed for out of network patients. Okay. These details are populated from the charge description master. Charge description master is a technical term wherein they have fed all these details for the CPT code and revenue code, and based on that, it will be going on. Once the charge entry is completed, a claim form is generated in the medical billing software, which will be UB04 form for facility claims and CMS 1500 form for provider claims. These questions they often ask you, because for if you have some experience, they ask this question often. Okay, these claims are generated can be submitted to the insurance through EDI. EDI stands for electronic data interchange. This is also for freshers, even they ask this question. What is EDI? Electronic data interchange. For the electronic claim process, in case the payer will be, insurance companies will be mentioned as payer in medical billing process. Okay, have that in mind. Does not have EDI payer ID. Payer ID is something which is a unique ID given for every insurance company in EDI system, so that once you select that payer ID itself, the claim form will be directly sent to them, to their inbox. If it's not there, they will have a fax number or can be sent through email as well. And even if that option is not there, still we have some insurance company that ask for paper claim forms. On that case, the forms are printed and sent to the insurance company claims address. On that, the PO box number, try to find it with PO box number, because how in US Postal Department works for these kinds of huge companies and corporations, they will have a dedicated PO box number for that particular company. The postman will come, take out all those on that PO box number. Once it reaches there, with this PO box number, they will drop it on the form. Then these people will have a key and they will take it to their company and work on that. Okay. So, and submit completed claims to the payer via clearinghouse. So how this reaches the payer, that's the insurance company, is in between there is a clearinghouse. Then this will be first reaching the clearinghouse based on the PO number. That's what I said it as claim submission address. That will be the clearinghouse address. Okay. Then the claim from form reaches the clearinghouse. The clearinghouse validates the form in the electronic claims. Only claims without format errors are called as clean forms. or forwarded to the insurance company. The forms with format errors or missing data are rejected as dropped claims. So what are all the claims which will pass through the clearinghouse are called as clean forms, and with those with format errors and missing data are rejected in the form of a dropped claims. This information, the information of dropped claims will be on the scrubber report. I haven't mentioned it on text writer typed here, but remember that report name as well. Very rarely they ask, because scrubber report will mostly come into the denial management part, but still, in case if they come up with a query that whether this form is true or not, then you should be checking on the scrubber report. The rejected claim is one which contains one or many errors found on the claim found before the claim is processed. Now, getting into the checklist for effective management of charge entry process. How to effectively manage this process? Those details are given by few points over we are going to discuss. Review of imported charges for accuracy before billing. So before you bill, as these are done automatically, you have to do a manual review. Okay, so check with the Excel sheet, and in case if you use an Excel sheet, make sure that you have it on read-only format with the password protect. Okay, or at least on read-only format, or else use a PDF. But for filtering and other options, Excel will be very easy. If you put Control F on PDF, it will be very hard, right? So you can use an Excel sheet, but you can filter it with the CPT code easily, but make sure that's on read-only format. If you put a Control D here, and based on this Excel sheet, if you change it there, then that also will lead to an error. So be very careful. Adherence to predefined provider-specific rules for different specialist and service rendered. So these are the commitments which you give. Review the quality of the process through a random audit. Random audit is even if you are all following all the process. That's what I say. Even a Control D in Excel, which is not set as read only, may lead to an error. So do something random and find out what are all the things happening like this. Review any pending or held documents with the client daily to reduce the backlogs. Perform a charge audit to identify any missed charges, instance of overbilling, and medical coding errors. So you have to do a charge audit where they will be checking on the missed charges, because for some CPT they would have missed it. Then that is a loss for the company. And after that, there is something called as claim submission periods. So within that, you have to submit the claim form. That's called as timely filing limit. The AR callers will check that as well. If the timely filing limit is missed out, then the insurance company won't pay for the claim. And in these cases, you cannot even write off. I told you, right, based on the procedure, certain scenarios only you can, you cannot even bill the patient for these kinds of things. You have to, it will be a provider write-off. Then they will be very angry on you. So don't miss out any charges. Instance of overbilling, even if you overbill, they will reject. That's why I told you, they will bill it for a wrong, put the charge for a wrong CPT, or the updates wouldn't have run properly. Because of that, some errors will happen. So these kinds of things there should be cleared, and those things we will discuss later in detail. And overbilling and medical coding errors. Even if the medical coding team does some error, that will be a problem. So those things also should be checked. Tracking of denial trends and benchmarks of fee schedules on the ongoing basis to ensure that there is reduction in claim denial. And also there may be changes on the fee schedule. You should be on constant touch with your provider office, and they should report that changes in fee schedule to you, so that you automatically change it, or the software system should automatically change it when the provider changes the fee schedule, and the timelines to be correctly followed. That comes at workflow automation to provide daily reporting to the customer and facilitate collaboration to ensure compliance and timely filing norms. That's what I told you earlier. If you don't file it submit the claim form within a time, you cannot file it again. You can some cases it can be appealed, some cases it cannot be appealed as well. On those cases, it will be a write-off for the provider, and you cannot go ahead and ask the patient for all this, even if you get the waiver of liability form. Okay. Definition of some frequently asked questions. Definitions of a super bill. In medical billing, a super bill is a detailed invoice or receipt outlining the services provided by a healthcare provider to its patient/client or client. This receipt also contains other information like appointments, visit information, CPT and ICD codes, patient information, and provider information. This is about the super bill. Who completes the super bill? The super bill is generated by the provider and is translated by the medical billing submitter. The medical billing submitter, the charge entry team, will extract the details of the services and this information into either a C and convert this information either into a CMS 150 form or a UB0 form. The claims may be sent to the insurance company via mail or electronically. So the charge entry team is completing the super bill and sending it to the insurance team. Okay. Charge tickets. What are charge tickets? Charge tickets are list of procedures that are commonly used. The other name of charge forms are charge tickets or super bill, route sheet, route slip, and charge tickets. So these are all given on the various names. So you should be aware of all these. If they say that we don't use super bill, then you should be able to say whether you use a route sheet, route slip, or charge ticket. You shouldn't get stuck here as well. This also it's an important question for seniors, because the particular company or your interviewer will be handling so many providers and so many facilities. Will be if you are going for a senior level, then they will expect, they may find these two different names with two different providers or facility. They will be checking whether you have that kind of a knowledge. Okay. What is the charge sheet in medical billing? It is the most crucial juncture in the medical billing. The key details that are needed to get your insurance claim processed or entered here and include the fact sheet of the patient, physician details, information about insurance coverage of the patient, and billing information. Okay, so now we are going to discuss about what are modifiers used for. I already told you, right? In charge sheet, the doctor may give you the modifier, and in case of denial management, the AR calling team or the AR analyst would find out that this can be added with the modifier. Then they will go back to the medical coding team. In some cases, the medical coding team can directly get a add the modifier, and in some cases the medical coding team will go back to the provider and ask for a charge note. That particular it's a kind of a addition document to the office visit, which will be attached with the office visit or linked with the office visit. On that, the doctor will specify why he is adding this modifier. Based on that, then again the medical coding team will add the modifier and send it back. On that basis, you will submit a claim form. So the resubmission claim form will be generated. So this also you should understand. Regarding the claim forms, I will make video on the later part. At that time, I will explain more about the resubmission of claim forms, but that will take a lot of time. But those depth they won't ask it. So this general understanding is more than enough, because this modifier will come on two cases. One, initial itself during the claim submission, doctors will give, and during denial submission, denial management, these people will instruct and come. For that, the denial time, there are two timely filing limit. Timely filing limit for the flush claim and the timely filing limit for resubmitting claims. So the resubmitting claim deadline should be met here. So during the charge audit process, you have to be careful about those timelines as well. That's what is coming back. What is a charge audit? Charge audit helps reveal success of variance, including problems with charge entry, provider absence, failures of providers to report timely charges, a change in coding pattern, services not billed for, and other reasons for claim denial. So this is what which will be discussed on the charge audit team. So go through this and write it and memorize as well, because these kinds of questions also they mainly ask for senior people. What are charges in billing? Billed charges means the amount billed by the provider or the facility for an item or service. So what are charges in billing? What is the word charge means is the amount, the dollar value, which is billed by the provider for or the facility for that particular item or the service. That's called as charges. Okay. This question, even if you have few limited experience, they will expect. What is charge entry experience? The charge entry involves entering appropriate and accurate information, data, and values as part of a patient medical record. This may include medical and billing codes and insurance. So when they ask you what is the role of a charge entry person, also you can give this answer. Charge entry involves entering appropriate and accurate information, data, and values as part of patient medical records, which involves medical and billing codes to be transferred into charges and post and send to the insurance company in the form of claim form, which is UB04 for facility and CMS 1500 for providers. Okay, so that kind of answer will make it more accurate. Okay, and how you will find out of is the patient out of network or in network. So this is being done by the eligibility and verification team. The provides the details, is the patient insurance is valid. First they will check whether the insurance is valid and whether it is in network or out of network, and does this service covered, and does this service requires prior authorization or pre-certification. All these details will be given by the eligibility and verification team. Okay friends, with this we come to the end of this video, and on the end screen you will be having my entire playlist about demo and charge entry and payment posting. All these are non-voice processes in medical billing field, and medical coding I will make it as a separate playlist. And medical coding I won't go in depth because we can just give a definition for the general idea. And if you look at this playlist, I will be simultaneously adding the videos whichever I post in a particular order, so that we'll now be working on the charge entry things. Once we finish the charge entry things, we'll post videos about payment posting as well. And all these things will be clubbed under this single playlist that will be displayed on the end screen. And also I will display, will have a display of about the AR calling and all the medical billing related videos I have posted till date, and other interview preparation videos. And also you'll be having icons flashing with some other videos which are relevant to this. So click on that and watch all those. Mainly go through the playlist, because this charge entry will always be clubbed with the demo, and charge entry process will be a single process. So you should also have a detailed knowledge about demo entry, because those questions also will be frequently asked. So watch that entire playlist and press the thumbs up icon, share your queries on the comment box, or else you can also share your feedback, whether it's good or needs improvement, and all your queries and suggestions are welcome. And also share this video with your friends. And when you start a discussion, before you go for an interview, mainly if you are a fresher, your communication skill is very much important. And to ensure that you have a good communication skill, always stop this video and you can also take notes, and you can speak with your friends about this, or you can share it with your friends and have a discussion with them, and do well on the interviews. Also subscribe to my channel and ask your friends to subscribe and enable all notification. And it's time to say bye, and so Joel John J signing off from you. Bye.